Yes, a lot of people are staring, a lot of people asking questions.
I've had, did you hit her? Yes. Did she fall? What happened?
Yeah, we have got this question if she was in an accident or something happened to her. Yeah.
Sometimes the child say, why? Your mouth is very, very, very big.
They were being tested for all sorts of different things, and we would get sort of one diagnosis and then, no, wait, that's not it. And then another, and no, wait, that's not it. And then they finally did a biopsy of the inside of her cheek, and then they said, no, it's FIL.
The first 2 weeks of Mille's life, the doctor didn't know what's wrong with Mille, so we have a lot of treatments and all that for Mille. And actually found out she had FIL after 1 year.
I think it was when he was like a 1 year old, because we were doing research, going to every doctor in Colombia, but they didn't know what it was. They say that it was something else than it wasn't. Till we find someone in the US, I believe it was, and we sent all the attempts that they did to Samuel, and they replied to us and say, okay, this is FIL.
It was a couple of days after she was born, they noticed that her cheek looked slightly inflamed, and they weren't sure what that was. And then it wasn't till after they'd taken a biopsy of inside her mouth at about 18 months, and then following on from that, we had the correct diagnosis.
When he was born, I have see a more big face on the right side, and the doctor, they don't know what is it. And then we go in Reggio Emilia to a genetic doctor, and she has supposed this facial infiltrating lipomatosis, and was correct.
She hasn't had any surgeries yet. We did try her on sirolimus as a first option, and then we're just sort of waiting out to see how she wants to continue with things. We do have some surgeries, oral surgeries coming up though.
She got 4 surgeries already now. So the first one was, she was 1 year old, and after that, 2 years old.
He has 3 surgeries. The first one was when he was 2 years old, and after that one, we did 2 more, like 2 years after the first one, and then 1 year after the second one.
But we haven't had any other surgeries on her face. We've decided to wait for the moment. But she is, in September, she started on sirolimus.
At first, it was hard. It was hard to throw, to say, wow, what is happening here? But he is like us. Like a really nice kid that he's growing, he's smart, it's not complaining anything. It's not getting, this is not getting him doing anything in his life. So that's the best part, I believe.
It's a little tricky to navigate. You don't really know what to tell them to arm them with the right information to be able to deal with the other kids, and questions that get answered, or questions that get questioned.
Yeah, sometimes we got some questions, but it's okay to get questions, but not for all the time. So sometimes you just will walk alone at the street.
Some people start just, I don't know, just to see what it is. But some other people is the one that we don't like, is the one that stare and keep staring at him. And so
it's when you go out, like maybe today when we've been traveling, or you go out for a trip somewhere, that's when we notice sometimes people staring and looking.
They'll ask what happened, or where did you fall, or what happened to you. So yeah, she gets asked that still fairly frequently.
I would just try to briefly explain and then reassure them by saying, oh, but she's fine and she's playing and she's happy, and then move the conversation on. So with a question or something like that, not that we're lingering there and there's a bit of an awkward end. So that's how we try to deal with it.
We've had kids just full on come up and just touch Holly's face, and she doesn't know what to do with that sometimes.
They say, you have face like a balloon. You are a very, very, very big face. It's not very easy every day, but so I think that he can go along very, very well.
I mean, when he was younger, he didn't see it. He didn't. Well, he was not aware of that. But now that he is like when he was like 8 or 7 or 8, he started like asking why people are staring at me and everything.
If she goes into a room of new people, often we notice she tucks her lip in because her lip would hang down. So she tries to tuck it in. So we notice her doing that. And I think sometimes she would then come up to me if she feels like people are looking for a bit of reassurance. I don't think she particularly likes it if someone asks her, why do you look like that? She'll just often say, I don't know.
Mille lives a normal life, but of course sometimes she think about she looks different. But she normal, happy, and some days it's okay, and other days she crying. So yeah.
She likes to call it her kissing cheek, though. So when people ask her, she'll say, oh, I was just born with that. It's my kissing cheek. So she's very aware. We're very open with her, and as are the doctors, we encourage them to talk to her, not to myself, just so we can get all the out information.
He will explain them, okay, this is something that I have from the beginning of my age and everything. So
it used to really bother her when she was a little younger, but at 9, she's now able to say like, they're staring, and walk away from that conversation.
Sometimes she smiled to them, and sometimes she look the other way, so she not have the eye contact.
Yeah, it's not pleasant, is it? No, it's not pleasant. We try to say hello and smile, and that often breaks the stare, and the person's then aware of what they're doing. Or sometimes it's a child and they're really not wanting to be unkind, they're just curious, they haven't seen it before.
If they ask normally, there is no problem. When the people say, ha ha ha, watch, I won't respond there, but
Makes me really sad. Breaks my heart, because you can't just take it away.
We have to listen to her, because she and hear what she feel and all that.
I think love is the best way to go through everything. So,
and we always say she is a special star, and we can understand it's difficult and in her position sometimes.
No, but listening a lot helps. I know that sometimes even when Holly seems like she's really confident and strong, that sometimes at night she'll admit that she's not as confident as I saw today. And so to keep talking in the evenings, even when they've had a good day, that it might not have been as good of a day as they thought. So open conversations, I think, are really helpful.
So it's very important to give your child some self-confidence and always listen to your child.
Yeah, we try to have it as an open topic, not that it's this topic that can't be spoken of or that's awkward. We try to have it that it's something that she can just openly talk to us about.
Play in the life, smile to the life. It's not easy, but if you smile, you can go on very, very, very good.